Okay, so like I mentioned, if you see the video before about doing an intake with Dr. Elena, you do a few different health questionnaires to fill things out. Blood work is common for her to order, as well as saliva test. And in our first meeting, she said, and if you're willing to do like a gut microbe test, we could do that too. And I said, what is that? And she said, it's a poop test. I said,
That's the easiest test.
what? Okay, so what is a poop test? Who should get one? And what would it tell you? And then maybe a real quick lesson on how to do it.
Oh, okay, goodness. Well, let's break it down.
Okay.
So what's a poop test? It's collection of poop. So basically it's a stool sample. You go to the bathroom, but instead of donating your sample in the toilet bowl, you just do it in a container that you're willing to part with no hard feelings. And after that, you collect with the aid of a spatula and a brush that's included in that testing kit. You obtain a representative sample of the stool into a flask. You close the lid, you send it back to the lab, and it gets interpreted. So what information do we obtain from that stool test? We obtain information about the entire gut microbiome. So I participate with BiomeFX. BiomeFX uses the newest technology, which uses the entire human genome project to evaluate your microbiome. A lot of patients don't want to do that simply because they do not have a patent for being diagnostic, and it is not reimbursed by insurances. So therefore, I also participate with Diagnostic Solutions, which offers the older testing method, 16S RNA testing, that only investigates pieces of the puzzles to kind of give you a glimpse of what's going on, and you kind of have to indirectly put that puzzle together based on the results that you get. So the test evaluates your gut microbiome. What does that tell you? Whether your commensal bacteria are within normal levels and their reference ranges to compare with. It also gives information on whether there are any pathogens present, viruses, protozoa, worms, anything that really should not be there. Absolutely. And they should be at undetectable levels. It also gives you information about your keystone species. Most people understand good bacteria and bad bacteria. So keystones, but they're both supposed to be there. It's just in balance with each other. When there is a discrepancy in that balance, that's when you have gut symptoms and what we call gut dysbiosis, right? So that imbalance between the good and bad bacteria. The good bacteria are the keystone species. Everybody is supposed to have them at adequate levels. Higher or lower levels indicate different things of what's going on in the gut. We also get information about specific markers that look for pancreatic function, whether that pancreas has two functions, exocrine and endocrine. Endocrine is related to that insulin release, and then exocrine participates in digestion. It produces pancreatic enzymes that are involved in the digestion of fats and carbohydrates and proteins. So are your markers adequate to suggest proper functioning of your pancreas versus their markers that signify pancreatic insufficiency, and we need to take further steps from there to treat with pancreatic enzymes, bile, if that is an issue, things like that. It also gives us information about beta-glucuronidase, and that's the one level that ties in to our hormonal balance. What is beta-glucuronidase? It is an enzyme that is produced by a gram-negative bacteria in our gut, and when they're overgrown and they create too much of this enzyme, they're able to deconjugate our estrogen metabolites, send them back into the circulation through the bile to be remetabolized in the liver. But in the process of this happening, those estrogen metabolites are just as strong, if not more potent than their parent estrogens. And those add to the total estrogen burden. And that translates for women, all that gibberish translates to women, for women, in symptoms of anxiety, irritability, anxiousness, things that we don't really want to feel or experience. So it's not just a matter of adjusting the levels of your hormone therapy. if you're receiving estrogen and or progesterone, and you should receive progesterone regardless. That's topic for another story. So it's not really the levels, but how are you metabolizing them, and are you really excreting them in the stool, and are you having that daily bowel movement? Because constipation would lead to increased fermentation, and we see markers in the gut study, and that beta-glucuronidase level can increase and affect your estrogen metabolism. We also get information about your immune secretory function, any kind of autoimmune response against gliadin, which is wheat. We also get information about calprotectin, and that is an inflammatory marker that describes inflammation related to the colon specifically. And we also get information about intestinal permeability, also known as leaky gut. Most people have heard of leaky gut, right? So that tells us what's going on in the gut. We tie it in, we figure out if there's low stomach acid, pancreatic insufficiency, inflammation anywhere, dysbiosis in those gut bacteria, what's going on with our commensal phyla. Gathering that information helps us gear the treatment that is right for you, because your treatment is not the same that what I needed when I needed to be tested, or your story is different. Your symptoms may be the same, but the dysfunction is maybe completely different. So that's why we get a stool test, because the gut is the foundation of hormone balance.
The gut is the foundation of hormone balance.
Absolutely. I'm not sure exactly when we're going to air this episode, but there is a webinar that's coming up. I will be hosting it on October 10th. It talks about gut and hormone axis. So unlike Vegas, what happens in the gut does not stay in the gut. It has systemic implications. So knowing what's going on in the gut, correcting that is foundational for hormone balance and for overall health and well-being.
Yeah, you blew my mind when you talked about how gut health is related to hormone health. Like those pieces had never been connected before.
It is
for me at all.
Oh, and guess what? I don't have to send you to the gastroenterologist. And from there, you don't have to be sent to, I don't know,
a million other places that don't talk to each other. So
Correct.
There's no actual result of all the testing. That's crazy. Well, she ordered the poop test for me. It is sitting on my kitchen table right now, which is actually a weird place to keep it now that I'm thinking about it. And we'll be doing that thing. So
maybe we'll share the results.
I think we will.
Think about it. It's her test, so it's up to her.
It's my poop. Yeah, it's so weird. Okay. Well, thank you very much for that explanation. Go order your poop tests today.
My pleasure.